All right, it's getting fun up in here. We're playing the Guess the Metabolic Disorder guessing game. All right, so a patient presents to you, or you feel like you have fatigue, depression, poor concentration, intolerance to cold, meaning you're cold all the time, you're experiencing some weight gain, constipation, dry skin, lateral eyebrow thinning. So usually it's about the outer third of the eye, you start to lose your eyelashes. A lot of people getting microblading, they have this metabolic disorder. Dry skin, menstrual irregularities, low body temperature, sorry, you can see my light there, and a lot of fluid retention. Feeling really bloated and puffy a lot. So who can guess what this is? It is hypothyroid. And I have seen so much of this in my practice. So, you know, there's a range of symptoms. So I really wanted to like write them all out so you can see them. And then also I want to show you really quick because I just get so sick and tired of patients coming in here and telling me they've been to the doctor and they are telling them that their thyroid's normal. And I'm like, bring me your blood work. Let me see what your doctor told you is normal. And then they have a TSH that's like 4.2 and they didn't even test for anything else, or they didn't test for their antibodies. So I want to show you really quick what's going on. And hopefully I have enough room over here. So you have your brain. This is my really fancy picture. And then you have your thyroid, which the thyroid is right here in the neck, right? So the brain has to tell the thyroid what to do. So it produces TSH, thyroid stimulating hormone, right? And then out comes thyroid and it produces T4, which gets converted into free T4. That's what comes out of the thyroid. Then that gets into the bloodstream, and then that actually has to go to the liver, it has to go to other cells, the heart cells. There's a lot of different cells that actually convert T4 into T3. All right, you guys, T3 is like the star on the team, the star in your body. T3 is what gets into the cell. So that's your cute little cell. So in order for T3 to get into the cell, we have to have some minerals and we have to have some other things going on, making sure we don't have autoimmune issues. But this is what actually has to get there for your metabolism to work, for everything to function right, you know, to make sure the cells are working properly. So when you go get tested for your thyroid, what are regular conventional doctors doing? They're only testing this. And now there's what's called a negative feedback loop, which this goes up and then comes back and tells the brain if you have enough thyroid or not. But if you're just looking at this, you're getting one piece of the picture. And then if you have autoimmunity, you're also kicking off different, there's autoimmune markers like thyroid peroxidase and thyroglobulin antibodies that we also test. So I want you to know, if you are seeing a doctor and they're only testing this, the TSH, you need a new doctor. You need somebody that's looking at your thyroid comprehensively if you have all of these issues going on. So I wanted just to show you really quick the thyroid panel that I recommend. And this is just to kind of show you somebody that had an elevated thyroid here, that had been told forever that their thyroid was normal. You know, and there's different ranges. So doctors, regular doctors stay in a range of 0.1 and they'll say, you know, up to 4.5, you're totally normal. They'll send you home and disregard. You can have every single one of those symptoms. They'll run a TSH and they'll tell you you're normal. So I'm here to tell you you're not normal. You need a comprehensive thyroid panel to look at the full picture. So we look at the free T3, the free T4, the TSH, and we're also looking at thyroid, the TPO antibodies and the anti-TG. So sometimes it's hard to get a doctor to run all of those. And they have to, you know, code it right for your insurance to cover it. So we do it here in the office. So if this is something that you feel like you have not been fully worked up properly and you have a lot of these symptoms going on, and sorry for my little lamp there, reflecting, I can totally help you. You might be a great candidate for my program. Please shoot me a DM below. Let me know if you have any questions. Go over to my website. I have some free tools and some free webinars over there. Sign up for my newsletter and you can learn more about how we comprehensively look at what's going on with you to get you feeling well. Okay? All right. I'll be back soon.